Welcome to this latest edition of Combinations, the podcast from North Staffordshire Combined Healthcare NHS Trust. This Thursday is World Mental Health Day. World Mental Health Day is an opportunity for all of us to raise awareness of mental health issues and advocate against social stigma. The day provides an opportunity for everybody and their organisations to add to wider conversations that will be occurring on social media, television, elsewhere. And this year's theme is suicide and suicide prevention. This is something on which we've been helping to coordinate and support activities across the whole of the Staffordshire and Stoke-on-Trent STP. And to that end, a day after World Mental Health Day, this Friday, we're going to be holding our second suicide prevention conference. And I'm here with Lesley Whitaker. And Lesley, you've been involved in helping set up not just this year's conference, but last year's conference as well. So what delights have we got in store for this year?
Hi Joe, this is our second conference now, like you said. We were delighted to be quite quickly booked up with over 250 people coming from all different organisations, public sector, local authority, communities, etc. So this year we've got a couple of great speakers that spring to mind. I don't know if you've heard of the Zero Suicide Alliance, but we've actually got their co-founder Steve Mallon speaking, who sadly lost his son a few years ago. He's going to be talking about their mission. And also Sharon McDonnell, a lady who's been kind of leading the light with regards supporting people bereaved by suicide, and she's been doing a great study across the country, and the results of that are due out any time. We've got a great local group called Restoke who are going to be doing a creative piece with the audience. We had them last year, they had us all singing, etc. And also for the first year we've got a Suicide Prevention Award, which will be absolutely brilliant to give the award to somebody who's going that little bit extra, doing the extra mile for suicide prevention across the patch.
Now, are we allowed? This will be going out the day before. Are we allowed to unveil, or are we announcing it on the day?
That'll be on the day, Joe.
That'll be on the day, right? That's absolutely fine. So, obviously, just a very quick thing about the conference. Obviously, it's fully booked already, isn't it?
Yeah.
But everybody can follow on Twitter and social media on the day,
Yeah.
can't they? Either through the combined NHS account, or the Together We're Better Twitter account. So fantastic opportunity to do a second conference. Now, one of the highlights of last year was we had signed a suicide prevention charter, didn't we, across the whole piece, and all the organisations across our patch signing up to doing things. And I remember one of the main things that came out there was to introduce suicide prevention training and spread suicide prevention training.
It was, yes.
And Sue, I'm here with Sue Slater as well. Now, Sue, we've been doing quite a lot, haven't we, over the year since then, in particularly introducing suicide prevention training amongst our own staff and across Combined. I was wondering if you'd like to tell us a little bit about that.
Absolutely. What we have done over really the last couple of years is raising staff's awareness right across the trust. We have 1,500 staff, not all clinicians. There are a lot of administration staff, a lot of back staff. So the first thing that we wanted to do was to raise awareness by having an e-learning package around suicide and suicide prevention, because it's everybody's business. You don't have to be a clinician to be able to help somebody who's thinking about taking their own life. And currently we're over 90% compliant with that, so we know that there are at least 1,400 staff that have actually done this training, and that's brilliant because they go out into their communities and they're people that can now help to identify people that may be at risk and just have that tap on the shoulder. Do you want to talk? Do you want to chat? How are you feeling? Which we're hoping will start making a difference into the communities of Stoke-on-Trent and Staffordshire. The second element to that is that we have been delivering, Lesley and myself mainly, face-to-face training specifically for clinicians, and that's getting people in for half a day to be able to reflect on their work that they do on a day-to-day basis, working with people who are thinking about taking their own lives, or families where somebody is taking their own lives. And it's really an excellent opportunity for clinicians to come together and reflect on what they do on a day-to-day basis. So in the room you'll have people that may have just started with the trust and have got no experience of suicide, and you've got people that have been here 30 years and have got lots of experience, and that to start with is a brilliant sharing exercise. But the other main thing that we do is we translate the national figures around suicide into local figures. So we take the national figures and we relate them to the local picture for Stoke-on-Trent and Staffordshire, in order to raise clinicians' awareness about what are the risk factors particular to us and how they can identify them, and then how we can actually make people safe. In Stoke-on-Trent and Staffordshire, we've got quite a high unemployment rate. We've got literacy issues amongst a lot of the population that actually impacts on things like therapy. Are people able to take up therapy? Are they able to understand what the issues are? We've got particular issues around substance misuse in this area. Then lots of other things. These are all risk factors for suicide. Losing your job, losing your relationships, being isolated within your community, mental health issues, substance misuse issues. They all start adding together to create a picture where people then become at risk of thinking of taking their own lives.
And one of the things, isn't it, that people might not appreciate, because obviously this is listened to by the general public, not just clinicians or people involved in mental health, is that it isn't unusual. It's right. It's one of the biggest killers of men in their 40s in the UK. Is that right?
It's really interesting. Every year, close to 800,000 people take their own lives in the world. And in this year, last year, 2018, there were nearly 7,000 people took their own lives in the UK. And whilst we can actually identify certain groups of people being quite high risk, so you might say middle-aged men, that's one demographic, but actually there are no limitations. Children, old people, men, women, different genders, different races, everybody is at risk of having a certain set of circumstances that will lead them to consider to be taking their own lives. And it's really important that whilst we can identify those particular areas that may be at risk, or those particular people that may be at risk, that we don't blind ourselves to the person that may not fit into one of those high-risk groups, that may by circumstance be at risk. And for me personally, every time somebody takes their own life, this is a community tragedy. It absolutely is. There's no other rationale for it. It's not their choice if somebody is poorly. It's to where somebody would actually think that taking your own life is the solution to a problem is a devastating place to be, and I think that we need to recognise that as a community.
So obviously, one of the good things about an anniversary is it's a good time for looking back and celebrating what we've achieved so far, but also for looking forward and what more we can do. And as I understand it, we are taking that training that we've done internally in the trust, and we're going to be deploying that across the whole of Staffordshire and Stoke-on-Trent, aren't we?
Yes, we are. We put in a bid, North Staffordshire put in a bid to Health Education England, specifically wanting to develop our staff for suicide and self-harm prevention. We were lucky enough to get some money from that, and the CCGs have actually put some money into the pot. And we're very nearly at the final stages where we are looking to train up 15 people across the STP, that is all of the NHS and the councils. Will each have trainers trained up to be able to deliver self-harm and suicide mitigation and also self-awareness. This will enable them to go back into their organisations and cascade the training throughout their organisation. Also gives them access to specialised risk assessments and specialised safety protective care planning, which will be a huge benefit to all of our service users and the staff. The other aspect of this is that we will also be delivering suicide awareness directly to primary care, so GPs, practice nurses, so that they can actually recognise the risks and the symptoms that may lead you to think that somebody's at high risk of taking their own life, and then signpost them into our services. Because one of the things that we're very aware of, that of all the people that took their own lives, only 28% were involved in mental health services. Nearly 3/4 had no contact with us at all, and we need to raise the awareness out there. So primary services, social services, education, identifying people who are at risk and getting them the help that they need really quickly is important.
So we're working across local authorities, we're working across care services, we're working across acute hospitals, we're working across mental health, we're looking into GP surgeries, we're working into schools as well.
I'm not leading the work into schools, but in our service we have
Trailblazers.
We have the Trailblazers, and that's in our children's and adolescent services. They're doing an awful lot of work. They're going directly into schools and working with young people to protect them from suicide, protect them from mental health, and give them some coping strategies and mindfulness as well. So trying to help people prevent issues developing, but also to help people when issues have developed.
So I also was thinking, Joe, about with it being World Mental Health Day, just about staff and their well-being, and how it's important to spread the message. We've all seen it, it's okay to not be okay, but sometimes I do wonder that how many people do actually feel okay saying they're having a mental health problem or a stress problem, and I still think in the trust there's lots more we could possibly do with that. Doing loads at the minute on staff wellbeing. I know we've just done a big survey on staff wellbeing, and we're really working hard to try and understand what keeps staff feeling well at work, but I just think on World Mental Health Day it's maybe worth having a little conversation, taking 10 minutes out, having a cup of tea, having a chat with your colleagues and just saying, are we okay, is there anything we could do better to look after ourselves?
I think that's critically important. We know that, I think it was last year that 52 nurses took their own lives. Yeah. That's 1 a week. For me, it is about having that conversation with colleagues and recognising that we're at risk too, that we're not sort of out of the equation, that we have relationship breakdowns, we lose jobs, we get moved, we lose pay, all of these things add into those risk factors. So we need to look after ourselves. But for me, I take it since I've been doing this training, and Lesley's been giving me loads of clinical supervision around it, it's become really obvious to me when you look in places like, if I go to Tesco, there are some old people that go into Tesco that I think, I'm looking at them and I'm thinking, this is the one conversation you have every week when you come here. They live such lonely, isolated lives, and just because you're over 70 or 80 doesn't mean you won't take your own life. So every conversation that you have, whether you're in the supermarket and you're busy and somebody talks to you, whether you're at the petrol station, whether it's at work, is important and could make the difference, literally, between life and death for that individual.
Right, so I guess multifaceted. So lots of things we've done organisationally in the trust, lots of things we're doing organisationally across the piece, but bringing it right back, it's all about individuals. And as you're saying, Lesley, today, World Mental Health Day, just simply cup of tea, little conversation, whether it got to be a family member, staff colleague, whatever, can all make a difference. Yeah. Okay. Absolutely. Well, listen, good luck for the conference tomorrow. People can follow on social media, and we'll be doing a report as we go along on what happened there. And in the meantime, everybody listening, do your bit for World Mental Health Day.
Thank you very much.
Thank you.
Thanks very much. We hope you've enjoyed listening to this podcast from Combined Healthcare. If you'd like to find more, you can go to us on SoundCloud, SoundCloud/NHS Combinations, or you can search for us and subscribe for automatic downloads in iTunes. Thanks very much for listening.